Good evening, and tonight on The Probe, we set out as a country to immunize 20 million of the Ghanaian population in an attempt to attain herd immunity so that our lives can return to normal. It was just going fine until our quest to procure vaccines hit a snag due to the worldwide challenge in the acquisition of the serums, forcing government to resort to middlemen, even though we're told that the president was leading the quest himself. There's been a lot of talk this week about Sputnik V and the controversy about the amounts involved, from $18.5, $19 and $26, even though the market price is supposed to be $10. So far, we have been able to inoculate 852,047 persons. That's as at 7th May 2021, 4 p.m. And that data is available on the Ghana Health Service website. Just today also, the G7 announced a donation of 1 billion vaccine doses to the rest of the world by next year. Tonight, key question remains about how we can attain the 20% vaccination target as a potential threat of a third wave looms, because most of you, yes, you, have let your guard down. Welcome to The Probe on the Joy News channel. Joy 99.7 FM, Love 99.5 FM in Kumasi, affiliates across the 16 regions of Ghana. We're also live on myjoyonline.com. DSTV channel is 421, GoTV 144, and all social media platforms. Your questions are ready, and so are my guests. I am Emefa Apau. I'll be right back. Please stay. Welcome back, and this is The Probe with me, Emefa Apau. And tonight, my guests are Dr. Anthony Nsiah-Sarr, Presidential Advisor on Health. We have Professor Gordon Awundere, is the Director, West African Center for Cell Biology of Infectious Pathogens, WACPIP, also Department of Biochemistry and Molecular Cell Biology, College of Basic and Applied Sciences, UG. And then we also have Professor Kwejo Ansakuram. He's Immediate Past Director, Clinical Trials Unit, Department of Epidemiology, and the Gucci Memorial Institute for Medical Research. He's also with the College of Health Sciences, UG. And then we also have Dr. John Amwesi, Senior Lecturer at the Department of Global Health, School of Public Health, Kwame Nkrumah University of Science and Technology. And of course, he's the leader, Global Health and Infectious Diseases Research Group, KCCR. And then tonight also, joining me in the studio, we have Kwabna Menta Akando. I always want to add doctor to the name. He's a Jobusu MP ranking member, a Health Committee of Parliament. Thank you very much, gentlemen, for joining us here tonight on The Probe. I want to hear you on Zoom so that we can test that everything is fine. Hello, good evening. Great, I can hear Dr. Amwesi. Professor Ansakuram, good evening.
Hello, good evening.
Great, I can hear Dr. Nsiah-Sarr.
Good evening.
Great. And then Professor Gordon Awundere.
Good evening.
Super. And we have a wonderful night. And thank you very much for joining us here on The Probe. I'm sure your Sunday was good. But Dr. Nsiah-Sarr, there's something that has been raging for a while, especially when we went to Sakrawono. I don't know if you were there, but this is something that most people have condemned. We've heard from Occupy Ghana, we've heard from the Ghana Medical Association. A number of us have been condemning what we saw at Sakrawono. Is there really a position on this? Seeing this as a presidential advisor, what ran through your mind? Dr. Nsiah-Sarr.
Very much into your issue. Hello, good evening.
Great.
Can you hear me?
Yes, I can hear you.
Yeah, and good evening to your cherished viewers and listeners. Yeah, it's a concern to us. Apparently, I was not there. I had some other assignment in Accra, so I couldn't go. But what I know is that I went there earlier on to speak to the organizers of the funeral, what they are supposed to do. Unfortunately, there was a lot of crowd there, and the crowd control was a problem. But we insisted that the church service should be outdoors. And I saw that the church service was actually done on a very huge football park. But there were a lot of people there. What I heard was that initially everybody who entered there, they were washing water and soap to wash your hands and sanitizers. And initially they asked everybody to put on mask. We also asked them to arrange the chairs in such a way that they will be 1 meter apart.
Oh no, internet is failing us.
And then the chair service should be 2 hours. So what will take happen? Can you hear me?
Yes, we can hear you now. Perfect. Please go ahead.
Yeah, so that was the plan. But unfortunately, there was a problem, I understand, of crowd control. And that's where we saw later on after the funeral. But we hope and pray that because it was mainly done outside and it wasn't in an enclosed environment, we are very sure and hoping that nothing will happen. But we are following up. We are on the lookout to see whatever will happen from those who went. But we understand that people went from all over the country because you know how Sir John is, and then people love him, and that was what happened. But I believe that it's a lesson that nobody will allow that to happen again. We are tightening and we are trying to do new protocols for funerals because, as you are aware, we started with only 25 for barriers, and then the church service started, and then the church service also have funeral service. If you look at funerals, funeral is not only the barrier, but funeral is first the announcement of the funeral to the relatives themselves, the 1 week celebration, then the church service for the barrier itself, and then what we normally call my part of the country a year. The year proper is where people get together at 1 o'clock, close at 6 p.m. But there's something which has come in, which is causing the problem for us. That is the after funeral celebrations.
Okay.
Now people have been having dinners, and there's a buffet. And you know, when people go to dinner and there's music blaring there, we have to be very near to each other. Masks are not worn, and then that's where the problem is.
Okay.
So all these things, we are looking at it, and we will do it together of Minister of Chieftaincy Affairs and then also the chiefs of the people, so that we come together and then come out of protocols and what should be allowed and what should not be allowed.
But Dr. Nsiah, to the extent that we still have restrictions in place and protocols were broken, and the president, the vice president, all those who matter in this country, from judiciary, legislature, everywhere, they were all there. And this has been described as a super spreader by the scientists. Nobody has been punished, at least a week on. Don't we deserve an apology?
I think potentially, yes, it's a potential super spreader. I'll add the word potential.
Potential.
Yes, potential super spreader. I understand that the organizers and have been invited by the police. Normally, that's what happens when there is somebody, we think that somebody has broken the law. The people are invited, and then they go and then maybe say whatever they have to say. But I would say that I'm a bit sorry that all this thing happened. Maybe as a presidential advisor, I have to say that what we expected the funeral celebration to be was not what happened. People were there, so many people were there. Crowd control was a problem. And we are just hoping. We've already spent 1 week. We are waiting for the next 2-3 weeks. And after 2-3 weeks, if you don't have anybody who has gone to the funeral reporting, and then we do contact tracing and find out if there's any problem, I believe strongly that because it is mainly outside, and then a lot of people who were there, most of the people who were there have also had at least one dose of the vaccine. Some of them have 2 doses already before they went there. And then since if some people were wearing masks and some people were social distancing, we are hopeful that, and we pray that nothing happened. But I hope it doesn't happen again to anybody or anywhere in this country.
Okay, that's Dr. Nsiah. With that out of the way, because this is an issue that I've seen a lot of questions come in, we'll get into vaccine acquisition challenge amidst the potential threat of a third wave. We heard Dr. Amoisi during the week talk about that potential threat of a third wave. But Mr. Kando, you are one of those who had mentioned that we needed, some apology of a sort from the government. But before I hear from you, because you've heard from Dr. Anthony Nsiah, let's take a look at where we stand when it comes to COVID in the country. So our new cases is 49, our active cases 1,115. Our confirmed cases as a country is 94,493. Recoveries and discharges, we have 92,589. And our deaths stand at 789. That's where we stand when it comes to COVID. Without out of the way, it settles it for us. And then we can start off our discussion. But this is an audience-based question. I don't want to ask all the questions tonight. A lot of questions have come in. So we started off with the questions. So we have this one from Ebo. How many people in Ghana have been vaccinated out of the targeted 20 million? That's the first question. Then we have Cecilia. Do I still have to use a face mask when vaccinated? Key question. Benaya says, how difficult is it for two nations with established protocols to procure vaccines for the other, such that middlemen will have to be engaged? Afi says, if middlemen can enter into every nook and cranny to obtain vaccines at a fee, why can't the executive, legislature, judiciary, scientists, and even the media, which says is the fourth estate of the realm, combine their forces to enter same corners to get us the vaccine? Afi is asking. Savia says a committee was set up by the president, led by Professor Frimpong Boateng, to explore ways of vaccine production in Ghana. What has happened to it? Savia is asking. So that's our first match. We'll get into the answers for it. So the first question, I think I'll ask the scientists first. Do I still have to use a face mask when vaccinated? Cecilia is asking. Dr. Moesi, I'm sure we'll get to you on this one. We'll start with you on that.
No, thank you very much, Emifa, and good evening to my panelists, distinguished panelists, and also to all listeners all over. I think it's a really important discussion we're having. And the question of having to wear the mask or not after being vaccinated, it's a bit of a tricky one. It's actually steeped in public health policy and a real understanding of what the risks are. Now, if you look at things carefully, you realize that the policies differ from place to place. Recently, the US CDC provided some guidelines whereby if you have been vaccinated, can you confirm you can hear me? Because I
yes,
can see my lines.
We can hear you loud
choppy.
and clear. You're fine. Okay, so just when he asked, we froze. Professor Wenderi, you would want to add that quickly, then yes, I think we can hear you now. But let's quickly go to Professor Wenderi on this so that we can take as many questions as possible. Professor Wenderi, you'd want to add to that?
Yes, good evening. Yeah, I think that it's advisable to still wear the mask, especially in our part of the world where the vaccination rates are so low. At the moment, we are talking about less than 5% of the people being vaccinated. So, you know, even though you may be fully vaccinated, you know, it's only, you know, a small percentage of the people who have been vaccinated. So it's advisable that we should still keep the mask on because so many other people are not vaccinated yet and could be carrying the virus. And even if you are vaccinated, remember that you can still get infected.
Okay.
Because, yeah, you can still get infected. And more importantly, you can get infected by a variant which may be resistant to the vaccine that you've taken. You know, now there are many countries where people have been fully vaccinated but still been infected.
Okay.
You know, Seychelles is going on in Seychelles, I'm sure you've heard, where coverage is over 60%, but infection rates are going up. And that is likely because of the types of variants that they have there, you know, as against the vaccines that they've used. So if the vaccine is not very effective against the variants that are in circulation, then you have a problem.
Okay. Well, Dr. Moesi, you want to finish on that quickly, just a minute, then we can finish on that and go to Professor Korankwo on this.
Yeah. So I was pointing out that there are different policies that exist in different countries. The US CDC, for example, recommends that if two people have been vaccinated and they're together, they need not necessarily wear a mask.
Okay.
And in Germany also it is the same policy. But I'm not saying we should do that here. In the light of the really low vaccination rates that we have here, in the light of our, I won't say choice of vaccine, but the vaccine that we had, which is at a lower level of efficacy than what was used in Germany to a large extent and the US, and also the threat of new variants coming into the country and arising de novo, the smartest thing to do would be to continue the mask wearing,
okay.
All right? But definitely we're hoping that when we go beyond a certain point in our vaccination levels, then we can afford to take on those policies which allow us not to wear the nose mask.
Okay. Professor Ansakram, am I wearing it for me? I'm wearing for the others.
Well, again, it's a very tricky question here, but it's both, really. I mean, if you are not vaccinated, you are wearing it for the others and for yourself. If you are vaccinated, you're probably also wearing it for the others and yourself.
Okay.
As was mentioned, what we need to understand is that most of the vaccines in circulation now or in use now were trialed to prevent the severe disease. It sort of relieve the pressures on the hospitals. So if you look at the UK, for example, they're still getting fairly large numbers of infections, but people are not getting into hospital as before. So we should be careful about throwing off the mask and things, because if you get infected, you're going to contribute to the transmission pool. And as has been mentioned, with a very low rate of vaccination, I don't think we are at the stage where we can throw off the mask and say that I've been vaccinated.
Okay.
I think we should do it.
Well, Dr. Nsiah, there's a key question asking how many persons in Ghana have been vaccinated out of the targeted 20 million. Dr. Nsiah, you have to unmute.
You're muted. You're muted.
As I'm aware, can you hear me?
Yes, we can.
Yes, nearly about 900,000 people have had their first dose of vaccination, and 382 of the 900,000, 382,000 and 900,000 have their second dose. So I can say that 382,000 people have their full vaccination.
What's the percentage out of the 20 million that we are targeting? What percentage are we?
If it is even 1 million, it means it's about 5% of the people who have been vaccinated. So we have a long way to go. With our
quest for herd immunity?
For herd immunity, and we are working assiduously towards that.
Okay, and there was also a question about how difficult it is for two nations with established protocols to procure vaccines for the other, such that middlemen will have to be engaged for us to do so. What is really the challenge in acquisition of vaccines in Ghana?
The challenge of acquisition of vaccines, not only in Ghana, but in the third world countries or the lower middle income economy, is because of vaccine nationalism, which is going on. You know that Africa, for that matter...
we're losing you.
You're losing me? Hello?
We can hear you. We can hear you, Dr. Nsiah.
Yes. Africa only has two manufacturing, that's fill and finish, three fill and finish vaccine production for the normal vaccine for children. In Africa, three. So about 99% of vaccines that comes to Africa are all imported. So the vaccines, the COVID vaccines are all imported. We have to import them from Europe and also in America and India. As you are aware, we were getting vaccines from sources. The first source was from COVAX. We also can procure vaccines from the African Medicine Supply Platform. And then we also can produce vaccines from government to government basis. That is what we started doing until of late, when India started having problems, and then AstraZeneca that we are getting from Serum Institute of India became a problem. So we have to start looking for where we can get vaccines from. And a policy that we will do emergency use authorization by our Food and Drugs Authority, and we want to use multiple vaccines so that we don't have any problems with vaccine acquisition. That's the reason why we have 3 vaccines which have had emergency use authorization. One is the AstraZeneca from Serum Institute of India, and another one is also...
No. So he just froze at that point. He was giving us the vaccines that has been approved for emergency use in Ghana. We've only gone through AstraZeneca. We know that the other one is Sputnik V. And that's when I bring in Mr. Akando. He's mentioned, I'm sure you can't count the number of times you've mentioned Sputnik V this week. So really, what is the briefing from your committee in terms of where we are when it comes to vaccination in the country?
Okay, let me say good evening to your viewers, and start by saying that if you are in a situation such as ours fighting a pandemic, the kind of decision you take and the time for that particular decisions are all very important. And I'll give you one typical example to explain that point. For example, at a point in time, we wanted to do testing at our airport, Kotoka International Airport. And can you imagine if we had given this particular contract to Noguchi Memorial Institute, a state institution which is internationally, accepted or recognized, Now it is told that this company, Frontier, is raking in a lot of millions of dollars, you understand? If Noguchi had this money, at least probably there could have been a collaboration between the West Africa Center for Cell Biology and Pathogens, so that they will come together and probably start the sequencing of the genetic identification of the virus, and that will in turn yield a lot of dividends to the country. So our decisions and their timing are very, very, very crucial. Now let's come back to the quest for vaccines and why we are not getting, why we are selling it
country to country,
those prices. And number one, at the committee level, the minister appeared before the committee for the budget estimate, and we asked them clear questions, and they mentioned to us that no vaccine is going to be sold or is going to be bought more than $10 per dose.
That's what they told the committee?
That's what they told the committee. And so when we approve the lump sum for the ministry, it is up to them to go, so that if there is any agreement, whether international agreement or whatever, they will then come back to the committee or parliament for the approval of that particular agreement. And so when we heard that they've entered into negotiations or agreement with people from Dubai to buy 1 dose of Sputnik 5 at $19, I was really shocked. Because you see, let's put the issues in its perspective. You know, vaccines are very delicate medications. They are not like any commodity that you can walk into the market and go and buy them. No, they are not like that. And so that is why, if you remember, WHO has warned that countries must deal with manufacturers or country-to-country transactions. And because if we engage intermediaries, middlemen, we risk getting substandard vaccines. You understand? And so it's very important how they are produced, the manufacturing date, batch, where they are even stored before they are transported, must be taken into consideration. And so we don't engage intermediaries in these matters. And in Ghana, we don't have any record at all for taking vaccines from intermediaries.
Okay.
So I am shocked. So we decided to ask more questions, and we were told, as released by the ministry, that they were finding it very difficult to do that.
Because there are challenges everywhere.
Yes, government to government transaction or dealing with the manufacturer. And I find it very difficult to believe that. That at this point in time, Kwame Nkrumah's Ghana finds it very difficult to negotiate or to engage Russia. I mean, you know about the Ghana-Russia axis, the kind of relations we have with Russia, the kind of relations we have with China, the kind of relations we have with Cuba and what have you. So how is it very difficult to engage the government of Russia? Especially, as I speak to you now, do you know Sputnik is in this country? We have Sputnik in this country. We have Sputnik in this country. How did we get it? They have gone to, they are developing another vaccine, which is the Sputnik Light. That one is one jab. And so they are now going through the processes. They've gone through, FDA, and they've had clearance to start clinical trials. That particular company, the manufacturer that we are looking for in the whole world that we are not seeing, is right here in Ghana. Is it? So if you tell me that you are finding it difficult to do that transaction with the manufacturer, should I believe it? Okay. Should I? Have we spoken to UK for the AstraZeneca? Have we spoken? I hear Korea is also producing AstraZeneca. Have we spoken to them? You see, if we do that, we put ourselves into a very tight corner. Our diplomatic relations are questioned. To the extent that Ghana cannot enter into bilateral, multilateral relationship agreement with these companies in order to secure us, vaccines. And what makes it more bizarre is the point that Sputnik in Russia issued a press statement that a dose of Sputnik should not be sold more than $10 in the international market. And that is what triggered this Norwegian investigation. The Norwegian journalist called me and requested of me to collaborate or to cooperate with him to investigate this.
Okay, so we would want to do a larger discussion on this vaccine acquisition, but you've mentioned a couple of things, and there were some questions also that Dr. Nsiah-Sarrey had to complete for us. We are told right now in the studio that we have Sputnik Light in the country. It appears that we are able to produce here. I want to hear on this, from the scientists on our quest for acquisition of these vaccines. But there was a question that I would want you to quickly respond to, Dr. Nsiah-Sarrey. They're asking about the committee that was set up by the president, led by Professor Frimpong to explore ways of vaccine production in Ghana. What has happened to it? And the issue about our quest to using middlemen instead of country-to-country arrangement.
Thank you very much. The committee set up by His Excellency the President for the vaccine acquisition is working very, very hard. I happen to be a member of the committee, and we've been working hard. You can ask Professor Awan. The universities, we've met the scientists, we've met a lot of people who have shown interest in it. So we will see the light very soon. And that is so the committee is working hard. We meet several times in a week.
Okay.
So very soon we'll have our own vaccine production, if for nothing at all, fill and finish. But we are also targeting the other EPI vaccines. So it's not only what do you call it? COVID-19 vaccines that we are trying to produce.
Okay, so you're telling us about the third vaccine that we are bringing apart from Sputnik and AstraZeneca?
Johnson & Johnson.
Okay, Johnson & But Professor Awendere, you've mentioned in this...
Let me quickly answer Honorable. It is not true that government is not doing government to government in negotiations. We are engaging the Russian government. We are engaging the UK government. We are engaging the American president and everybody. So please, we got it wrong. It is not true.
So how are you using middlemen then in the latest expose that we've seen? How come we are using middlemen?
I think the minister has come out to tell us exactly why he used maybe the middleman, which I don't want to belabor it. What I will say is that I'm challenging him today that the $10 he's talking about is the ex-factory price. And I want everybody here, including himself, if he can get vaccine for us at $10 for Ghanaians, we will clap for him and then we will let him, he will be engaged to tell us where he'll get the vaccine from.
Okay.
You see, you should also realize that there is problem. For example, we are getting AstraZeneca from India. The AstraZeneca, which is made in UK and Europe, was supposed to be made there for the European market. That's the reason why Serum Institute of India was given the authorization to do AstraZeneca, keep half and then send half to the lower and middle income economy. If he doesn't know, I'm telling him today. And until they were supplying the AstraZeneca through the COVAX system and through African Supply Medicine platform, until they had a problem and they have to vaccinate their people. So please, if he's saying something, you should get the facts very right. It is not true that government is not engaged. As we speak now, government is still engaging the Russian government. And very soon,
and where are we with it? And where are we with that engagement? Where are we with that engagement?
We have gone very far.
So we are getting vaccines soon from Russia?
Yes. So it's likely we'll get a vaccine also from the Russian. We'll get a lot of vaccine from.
Are we buying or is for free? Are we buying or is for free? How much are we buying it for?
The only vaccine we'll not pay for is the COVAX.
So how much are we paying Russia per dose? How much are we paying Russia per dose?
For what? For the
government-to-government interaction that you're having, how much are you getting per dose?
That is what we are negotiating for. Immediately it is true. We will let Ghanaians know.
Okay. So Professor Awendere and Professor Kram, I want to come to you briefly on that.
But what I'm saying is that if you can get somebody for $10, you should bring the
You've made that point, Dr. Nsiah-Sarri. You mentioned Professor Awendere, and then I'll also get some thoughts from Professor Kram. Then we can get into the next part of questions briefly. Professor Awendere, we are told that as scientists, you are being engaged, at least on vaccine production in Ghana. Your thoughts, where exactly are we with it?
Well, yes, it's true that as part of a team from University of Ghana, we have been engaging Prof. Frimpong Boateng's committee. And we've had some very fruitful discussions. So I think at this stage, what we're trying to do is to, brief them on the existing capacity that we have. Okay. And to tell them what we need in order to, take us to the level where we can, competitively make vaccines and actually make a difference. So I think it's a good discussion that's ongoing, but it's a long way to go. At the end of the day, it has to be backed by commitments. Some funds have to be committed. And I hope that we would, move quickly to set up a vaccine development fund of some sort, where the government can put some seed money and then call for private sector support to build a war chest for us to start to promote innovation locally.
Well, Professor Kram, really, our quest for vaccine and the challenges that we face. Briefly, your thoughts on where we are.
Oh, well, thank you very much. And picking up from where my colleagues have left off, I think vaccine production is a very good thing to do. And what we should also realize is that it's not a short-term issue. And in discussing with some other colleagues, I think in our current situation, and if you take COVID, for example, probably, in my view, one of the best options will be to have a licensing agreement to start a production plant here or something like that, rather than doing things from scratch, because it's a long haul and it's not an easy thing that if you started today, you're going to finish in 3 months or 6 months. I think I hope that the discussions which are going on will look at all these things. I like the idea that they're looking at producing the EPI vaccines, because it's been one of the things which has always been on my heart, that we should really contribute to protecting our children. We've always received the vaccines from Gavi, from UNICEF and things, but we should begin to put money into those things, because we've seen the benefits. I mean, measles and things have virtually disappeared. Neonatal tetanus. We're training doctors who don't see it now, which is good. In our time, that was the bread and butter. You have to go to fevers unit every day. You see a child with
It appears I'm losing Professor Ansakram there. Okay, so it looks like we have a terrible connection to Professor Ansakram. Let me just get into the next batch of questions on Facebook, then we can do another round. So on Facebook, Patricia says, it seems different efficacy percentages are being given with respect to the AstraZeneca vaccine. In any case, why go for a vaccine with 62% efficacy when other vaccines have higher efficacy? Patricia, they're being very scientific. Gifty says, which brand of vaccine is most effective against all the strains COVID-19 identified so far? That's Gifty's question. And Maxwell, it says, I'm aware of existence of 4 different variants of COVID-19. Do we have any of the above variants in Ghana apart from the UK? Please, can the vaccine cover other variants should new ones emerge? Is another question Maxwell is asking. Yehoada says, are we prepared as a country for a third wave if, God forbid, it hits us? What can be done to prevent it? That's Yehoada's question. And Irene says, is herd immunity possible at all per available data? We need about 75% vaccination to achieve herd immunity, but we have about 37% of our population below 16 years, and that's not eligible for vaccination. How then do we get herd immunity, given other factors like vaccine hesitancy that could further beat our figures down? Irene sends that one. So I can get answers to these ones briefly, then we can see if we can get another batch of it. So are we prepared as a country for a third wave if, God forbid, it hits us? Dr. Amoisi, you mentioned that potential threat of a third wave somewhere last week. You mentioned it, but do you think we are prepared if it hits us?
Well, I mean, the concept of a third wave is pretty straightforward and intuitive in epidemiology. These diseases, infectious diseases, they come in waves, and they will manifest when there is a susceptible population. When I say susceptible population, what I mean is that people who are at risk of being infected, potentially getting sick, and then further spreading the disease. And we do have such a population, particularly because we have not achieved a certain level of vaccination. Right? We're still not too sure how many people might have received immunity naturally because they've been infected, knew it or didn't know. We're not too sure about this just yet. On top of this, there's the additional layer of new variants, which would mean that even if you have immunity via vaccination or naturally to one strain, a new strain may mean you're just like a clean slate altogether. At best, you may have a milder form of disease. Now, this concept of a third wave has actually been established by the WHO, and I'm not surprised. Our own senior colleague, Dr. Machidi Somoeti, made this very clear that Africa is at risk of a third wave. And the statistics over the past 2 weeks actually show very clearly that we are in a third wave in Africa. Now, what is most important is how this wave will pan out. And this is what we don't know. How it will pan out in terms of not only the infections, but also how many of these infections will lead to sickness, how many will lead to hospitalizations, how many will lead to severe disease, how many will lead to deaths. This is what we cannot be too sure of, and it's not worth taking that risk. So to cut it short, yes, the risk of a third wave is real, it is imminent. How it will pan out is not very clear. But if what we've seen in India is anything to go by, then we really want to be ready for this. And currently, if you look at the statistics in Ghana, not in Ghana, in Africa in general, 1 ICU bed per 100,000. In Ghana, I think it's just about 5 per 100,000, if I'm right. But it shows that we really need to get ready for this, and if we don't, it could be potentially disastrous.
Okay, Professor Awendere, do we have other variants? Someone was asking that he's seen 4. I've heard about the alpha, the beta, the gamma, amongst others. Apart from the UK strain, we have other strains in this country.
Yes, we have many variants, but as you know, those that are of concern are the ones that we focus on. That means those that have been established to behave differently, to cause more severe disease, or to have a higher level of transmission. Those are the ones that we are worried about. And yes, unfortunately, we have some of those in the country. In addition to the alpha, which is the UK variant, we have the beta, which is the South African variant. Indeed, our recent sequencing, we found the Indian variant, which is the Delta and the Kappa. So we have all of them here. We've been fortunate that the more aggressive ones, which is the beta, the South African one, and the new ones, the Indian ones, they haven't taken root in the local transmission. So we've mainly found these in travelers. We haven't found a lot in local infections, which is a good thing. And we need to maintain that. That means that the mandatory quarantine we're doing at the airport, we need to maintain that and strengthen it. So anybody who tests positive at the airport needs to be strictly quarantined, because when we sequence samples from travelers, we find all kinds of variants in there. But when we sequence those in the local infections, then we don't find as many of the more aggressive variants.
Okay.
So it means that we need to keep blocking these at the airport with a mandatory quarantine for all the positive cases. And hopefully we would be able to, weather the storm. Now, linking it to the vaccines we are acquiring, I think that as we move forward, we have to be focusing on getting, the Pfizer, the Moderna, those other vaccines that are more effective against the more aggressive variants. Because it is inevitable that we'll get to the point where these variants will start to take root locally. So if we're anticipating vaccinations going forward, we should be moving towards, diversifying our mixture, our, vaccine supply, so that we are not relying only on AstraZeneca and Sputnik 5, because these would not be sufficient if we have Delta and Kappa and Beta taking roots locally. So that is what we need to pay attention to. But it's really, really important that the airport mandatory quarantine is strictly enforced.
Okay. Professor Kram, so the issue about efficacy, the question that was asked, now I'm also worried that if I've taken AstraZeneca and then we have the Delta, the Indian strain, the South African strain, or the Brazilian strain, or the other strains that we are getting in the country, what does it mean for me? Am I going to get it again? What exactly do we mean when it comes to the efficacy of AstraZeneca, for instance?
Thank you. I think one of the first things we should all take from these things is that no one is promising 100% efficacy from any of the vaccines which are on the market.
Okay.
And no vaccination program will promise that. Having said that, the other thing we need to understand is also that all the vaccines which were produced, at least the first wave that we have currently being used, the readouts on the vaccines were actually not to prevent infections, because that would have taken a longer time to do. The problem was also more of the hospitals being overrun, lack of oxygen and things. So the readout was to prevent severe disease.
Okay.
So as I said previously, there'll be some breakthrough infections. We need to accept that. But when the breakthrough comes, so far what has been seen is that they are not going to be that severe. People have not been severely ill, which need intensive care units, oxygen around the clock, ventilation, or whatever that is needed to take care of them. So what I'll say, yes, we've been vaccinated or you've been vaccinated. Don't worry much, but that brings back the question of whether you should continue to wear your mask. Okay. You should, because all the things we're doing now, talking about alpha, beta, delta, kappa, and things, variants, breaking through the vaccine cordon, as it were, if we put in the proper preventive protocols, very seriously, we don't have any infection at all going on. And then we'll be better off that way than trying to see whether we can prepare for getting infection from Kappa or something like that.
Okay.
As they've said, it's likely to come, so we should be aware. The hospitals and things, the oxygen production capacity and things have to be ramped up. We don't have to wait until the thing appears and then we realize that we can't produce oxygen or we don't have oxygen. Because we've all seen what it does to other places and we should learn from those things.
Okay, I'll be coming to the studio shortly to join Mr. Akando. But really, there was a question also some of my colleagues have been asking. It's been more than 2 months since they took their first jab. Some of them were not able to take the second. They say they took it in the second week of March. Dr. Nsiah-Sarah, when do they get their second dose? We've just finished the first batch, the first phase in the second round. When are they going to get their second jab?
Yeah, we are working very, very seriously and hard to get AstraZeneca into the system so they can have their second jab. I'm sure the scientists will tell you now, even the data shows that the longer you wait, towards 3 months, some of them have been saying 16 weeks, the better. So they shouldn't be very much disturbed. But we are working towards that.
But it appears that time keeps changing depending on the availability of the vaccine. Because earlier we were told 12 weeks, now we are told 17 weeks. By the next time we'll be told 3 months.
It's because of the availability of the vaccines. And then very soon, even, I'm sure, you see, the vaccination have just started. And nobody has given vaccination for more than 1 year. I think most countries started in, January, if I'm right. But Abos, isn't it? Most countries started in January.
That's right. Yes.
And
January was the first.
Giving the second dose, some waited for more than 12 weeks. And now the new thing which is coming out is that the longer you wait in between, the better. Very soon, I'm sure they will come and tell us that every 1 dose is enough. But I think that what we've been receiving communication from COVAX, and it's very hopeful that we will in few weeks. And
okay, so we've lost Dr. Nsiah-Sarah's connection once again, but let me come to the studio. So there's also a question for you that I see here, but of course, I'm sure you would want to quickly respond to Dr. Nsiah-Sarah on this. But there are also questions from Dr. Owusu, who is saying that what lessons have we drawn from this pandemic? Can Mr. Akando pledge to push for the passage of the research fund to aid scientists in the country? Dr. Owusu is asking, but there was a challenge on this $10 price for Sputnik V that you talked about in your committee. Briefly, if you can respond to that.
Emifa, the results of negotiations or engagement at the government-to-government level, we should be seeing the results. It is not Dr. Nsiah-Sarah who should be telling us, oh, we are engaging. If you are engaging, what is the results? Number two, you should check the press statement from the Ministry of Health, bullet paragraph 4 and paragraph 5. They clearly stated that effort to engage these government-to-government and manufacturers has not yielded any fruit. It isn't me saying it. You understand? It is the ministry saying it. I don't know whether it's in touch with the ministry or not. You know? So it is not me. I am only criticizing what the ministry has put forward. So that's about that. You see, as I speak to you now, are you aware that Ghana is on the executive board of WHO? We are there this year. So if we cannot use all these connections to secure vaccines for our country, then what are we doing? You asked a question about the looming third wave. I've heard that the best way to prevent this looming third wave is to do mass vaccination. And if we're not very careful and we go at the pace we are going now, by the end of the year, if we're not able to vaccinate a certain number of or proportion of the population, then we'll come back to ground zero or ground one. You understand? And so it is very important, even according to their own program. They have a document here. I requested it during the budget estimate.
What document?
And it is from the Ministry of Health. Okay, COVID-19 vaccine deployment and vaccination plan. They, according to their own document, they were supposed to vaccinate not less than 7 million people by 2nd June. I don't know whether, I don't know whether Dr. Nsiah-Sarah is aware of all these documents. Okay. He also made mention of the fact that if I can get vaccine at less than $10, I should come. You don't buy vaccines like vaccines are not tomatoes. Even if I can, I should not be allowed to do that. That is why there's government, there's a proper channel, and that is where they are eyeing. You see, if you have people advising the president in this direction, instead of advising the president to concentrate on manufacturers and government to government, is throwing it out there that anybody who has it. That's where we are giving the opportunity for intermediaries to come in, and we don't do that. That will not help the country.
Okay. So staying on third-party purchase, I think I want to bring Dr. Moisi in quickly on this issue about middlemen and third-party purchase. Some have raised concerns. At least I've had some people raise concerns that if we have middlemen purchasing it, aren't we worried about the efficacy of it? But please don't forget Dr. Wusu's question as well.
Research.
Dr. Moisi, a minute, if you could quickly touch on that for me.
Well, thanks, Amifa. And of course, you can see the wry smile on my face because it's a tricky issue. So I should say, I mean, quote unquote, I don't want to comment on the price of the vaccine, but I am, from a public health perspective, very concerned about the involvement of third parties. No, the reason is for a couple of reasons for that. Now, these are vaccines. These are things that we inject into people's arms. All right. So there's very little room for error. It's very different from bringing in fake spare parts, which also have their own public health problems, or fake radios or TVs and this kind of stuff. This is going into the arms of people with potential dire consequences if it goes wrong. I do recall we had this discussion several times prior to the vaccines coming in, and it was the clear position of the ministry and the Ghana Health Service that third parties were not going to be engaged in this because we all understand the public health implications. Now, there are forces, market forces, demand and supply. These pan out everywhere in the world. Now, because these forces are inherently inimical to the heart of public health, this is why there is legislation which can be activated. For example, in the US, they have the Defense Production Act, which was actually invoked by President Trump in late March 2020 to make sure that the production of important PPE, including ramping up the production of vaccines, etc., was done for the US, even the most capitalistic of societies. So forget about the price. I don't want to get into that discussion, but the very involvement of third parties is inimical to public health in itself. And to think about it, Ghana actually has been part of the Gavi board before. And by virtue of our status as a lower middle income country, if we are seen to be able to go out there and purchase through third parties, it actually limits our negotiation power if we want to receive things for free. I'm just talking pure public health here. So it is really not in our interest to be engaging in third parties in the purchase of vaccines. I may not understand the complexity involved in what is available, the accessibility and all that, but just the concept of third parties in here is not helpful.
Okay, well, I'll give you...
If I may just...
Wait, Dr. Nsiah, I'll give you the final word on this. We just have about 9 minutes to go. But Professor Ansah-Kram, quickly, I'll give you the final word, Dr. Nsiah. Professor Kram, you want to comment on this?
Yes, I was just going to say that I think Dr. Moisi has really put out a lot of things I wanted to say on this the first time. The point is that, I mean, in public health issues and things like that, and especially dealing with vaccines, the other thing we need to know and we need to understand is that we're taking a product to give to healthy people. It's unlike when you're taking a drug to go to somebody who is sick and things, and you think, okay, this may work, this may not work. The room for error on vaccines is probably non-existent, because if I give you a vaccine and you cannot wake up or you cannot go about your normal duties tomorrow morning, I don't have a vaccine. It may be the most efficacious vaccine around, we don't have a vaccine. So when we, as John is saying, I'm also not going to talk about pricing and everything, but if we're getting middlemen, what are the guarantees we are putting on what we are getting? What is in the vial? Do we know? Are we sure that we have what we want or what we are paying for? Do we have the capacity to test 3 million doses or 3 million vials when it arrives, so that when you pick the first 1 million, everything is fine, and 2 million of it, we don't know what it is and things. And I also get worried as a public health physician when we're using that sort of channel to get vaccines.
Okay. Professor Wandere, how about you? You had raised concerns about our vaccine acquisition and all. Now we are engaging middlemen or third parties. You have concerns about that?
Yeah, I think that you know, my colleagues have already underscored the risk associated with that. I think there are risks. So you have to really know who you are dealing with and you know, their track record and so on and so forth. So I think it's best to avoid. But if you have to deal with them, then you have to do a lot of due diligence before engaging middlemen.
Okay.
But I think at this point, like Dr. Nsiah-Sarri said, I think the diplomatic channels of going government to government is probably the best at this point, especially engaging with the US government, the UK government, where we know they are approaching the point where they will have vaccines to spare because they've made a lot of progress in vaccinating their people. So I think we should intensify those efforts and look in that direction.
Okay.
And I think really that's where, I said this in February, that we'll get to this point where we have to wait for these two countries to bail us out. And I think that's where we have to go now.
Yeah, you did. Well, Dr. Nsiah-Sarri, now this is where we are. There was also a talk about our plan. He's put out the Ghana Health Service, the Health Ministry plan of vaccinating 7 million Ghanaians by the 2nd of June. It's here in that document. So together with the issues about the threats of engaging third party, I'm sure you want to box those two together and respond to them.
Yeah, thank you very much. Thank you very much, Emifa. The problem is that the engagement of third party is something which not government is encouraging. Government is encouraging diplomatic sources. As I said, government is talking to the US government, the EU, also Russia, even China, and everywhere that they are manufacturing vaccines. And that is where we want to get our vaccines from. So that should be said. So secondly,
quickly, this contract that we've heard or we've seen go around, which we are engaging middlemen with the pricing and all, I'm sure, I don't know, you are the presidential advisor on this. I'm sure that you'd want to tell us, because we are told, we've heard from, civil society, we've heard from minority, all asking for an abrogation of that particular contract. Is there really a decision on that? Because you've mentioned that you're not engaging middlemen, but we've seen that contract. Is there a decision particularly on that? Are we abrogating that contract and then deal directly with the government?
I think every contract has got its contract terms. So the ministry signed a contract. They will look at all the contract terms and see if they have to abrogate it. If you look at that contract, it was 3.4 million, but they were supposed to deliver it, what I read, in batches. And they pay only when it has been delivered. And when it's delivered, FDA checks everything before it's even brought into is used in the country. If you have seen what is happening at the airport, anytime any vaccine comes from anywhere, there's check the batch number, where it's coming from, and all sorts of things. So that is what will be done. But I will tell you that His Excellency the President, for that matter, the government is seriously engaged. And as I speak now, we've engaged the US government. We are trying to get vaccines from there, even apart from what is going to COVAX and what is going to the African Union. We've engaged the EU, specifically the British government, to also make sure that we get vaccines into the country to vaccinate our people, as well as the Prime Minister of India. The only problem which happened was when they have the second wave, and then they have to stop or ban all exports. That's the reason why we have delayed. Okay. Yes, it was 17.6 million doses that we said we want to give by June ending, not by 2nd of June, by June ending.
Okay, so there's a plan here, and I'm seeing that we're supposed to do a target. 2nd June, we're supposed to do 7,936.
You can plan.
Okay.
But when you are planning, as you said, man proposes and God disposes. So when you plan and there is a problem, then you look at the plan again. But I can assure you that I'm very sure that after the end of the 3rd quarter of this year, there will be so much vaccines in the country that we can have enough vaccines to vaccinate Ghanaians to get our 20 million.
So our quest for herd immunity is still on, you would say?
It's still on. We haven't changed
by end of 2021.
Looking at what is coming to come in the 3rd and then the 4th quarter of the year, because Johnson & Johnson is coming on board. Dr. Wandare and Dr. Moisi talk about even getting Pfizer and the rest. We are also in the process of improving our cold chain system so that we can bring in Pfizer and Moderna to make sure that we have the whole range of vaccines in this country.
Okay.
So I'm assuring Ghanaians that that is what we are doing.
Okay.
The $10 I told Honorable Akando is that I just threw it in, that if he can get $10 for us, I'm not
so
saying
he tells you it's not like tomatoes for him to get it.
Yes.
But briefly,
Yes.
I'm really out of time. 30 seconds. I want to hear from the scientists. Scientists, yes or no answer.
Vaccines are just because if
Dr. Nsiah-Sarr, thank you so much, Dr. Nsiah-Sarr. Let me hear briefly from the scientists before we wrap up, Dr. Nsiah-Sarr. So I would want a yes or no answer. I know it's unfair, but our quest for herd immunity, Professor Awundere, still achievable? Yes or no?
It's achievable, but earliest will be 2022.
Okay. Professor Karam, for you, our quest for herd immunity, achievable?
Well, it's achievable. I mean, as I've always been saying, herd immunity is only achievable with massive vaccination.
Okay.
So I will not put the time on it, but I think I'll probably also go for 2022.
2022. Dr. Amoisi?
No, I think it is highly achievable. It could actually be achievable faster than we think, but only until we understand what our seroprevalence figures are. And if we can vaccinate to meet that gap as quickly as possible, then even maybe 2021, late 2021, we could do it, but it depends on all these variables.
Okay, that's more than a yes or a no. But thank you so much, gentlemen. Mr. Akando, unfortunately, we are out of time. Thank you so much for your time. I'm sure we'll definitely do this again. My guest, Mr. Minta Akando, Dwaboso MP, Ranking Health Committee in Parliament, joined me in the studio. We have Professor Ansa Kuram, former director of Noguchi. We also have Professor Awundere, Executive Director of WACPIP. And then Dr. John Amoisi is with the KCCR. And Dr. Anthony Nsiah-Sarr, thank you so much. He's the Presidential Advisor on Health. We'll do again another time here on The Probe. I am Emefa Apao. Thanks for your company.